Hi, I'm Megan.
Hi, Megan.
I'm a genetic counselor specializing in cancer genetics at Intermountain Healthcare. I work with families who are affected by cancer to see if there's an underlying genetic cause of the cancer in the family and to help them determine what the best course of action would be based on their family history.
Okay. Why do genetics and genetics counseling matter when it comes to cancer?
So about 3 out of 4 times they don't. So 3 out of 4 cancers are attributed to what we call sporadic causes. So things like environmental exposures, lifestyle factors like smoking, the fact that as we age our risk for cancer increases. So the majority of cancers aren't thought to be associated with genetic information. But about 10% of cancers are. So about 10% of the time that somebody has a cancer diagnosis, it can be attributed directly to a genetic or a hereditary predisposition to that cancer. So my job is to find out which families are which are the sporadic and which are the genetic cancers.
So how do I know if I need to talk to a genetics counselor?
Genetic counseling and genetic testing isn't appropriate for every family that has a cancer diagnosis. But to determine whether your family may benefit from genetic counseling and genetic testing, there's a couple things that you can look for. The first is cancer diagnosed at an unusually young age, such as breast cancer in the 30s and 40s or colon cancer under age 50. We look to see if the same person has developed multiple cancers or if there's multiple cancers within the same family. We look for bilateral cancers or cancers that are in both of a pair of organs, like both breasts. We look for cancer in the less common gender, like male breast cancer, and cancer in certain people with certain ethnic backgrounds, like Ashkenazi Jewish ancestry. We also look to see if a family member has been diagnosed with a genetic predisposition to cancer and use that information to help dictate what testing is appropriate for another member of that same family. So if any of those criteria applies to your family, it might be a good idea to get in touch with a genetic counselor.
What does a cancer genetics counseling session involve?
So when I see a patient or a family, I ask them a variety of questions about their personal and family history information. So some of those questions include, has anybody in the family ever had cancer? And I ask about aunts and uncles, cousins, siblings, children, parents, and grandparents. How old were they when they were diagnosed? What was the specific diagnosis in the family? And has anybody in the family ever had genetic testing before?
If I find out I have an increased risk for developing cancer due to my genetics, what happens then?
If we find out that there is a genetic condition causing cancer in your family, there's a lot of things that we do to help reduce your risk to develop cancer, help detect cancers if they do develop, a lot of things that we do for your medical management and make sure that families stay healthy. So we use the information to determine who in the family is at risk and then to determine what we should be considering to help reduce their risk to develop cancer.
That answers many of my questions. Thank you very much.
Great.